WION correspondent Yunfei Zhao from the streets of Wuhan, that is the epicenter of the coronavirus outbreak. Now, my first question to you, Yunfei, is that this has now become a real big cause of concern for the Chinese administration. We've got the latest figures just now. 6 health workers have died due to the virus and over 1,000 others have been infected. The health of frontline health workers is certainly something that the administration must care about a lot, because they are the ones actually treating the patients who've been infected by COVID-19.
Definitely, the medical workers are certainly a very important group of people that the official has to take in good care of. So we're talking about at the beginning stage, a lot of hospitals recognize that there is extremely shortage of medical gear and protection suits, but the local government is speeding up its supply to the local hospitals in terms of gear and protection suits. So hopefully the medical workers will get a chance to have a better resources to protect themselves. And on the other hand, the central government has dispatched military medical teams as well as the local medical teams all to the epicenter of the coronavirus outbreak. So that kind of action can relieve the pressure in the epicenter, especially manpower resources. And it's kind of conducting a province aid city mechanism, meaning that each province or municipalities will take in charge of one city here in Hubei province. By that means the sources will be evenly distributed and there's no corner will be missed out.
Yunfei, very importantly, a question that comes to mind is that if over 1,000 frontline health workers have been infected by COVID-19, do China have enough health workers to substitute those who've been infected, because they will need to be quarantined and treated as well? And secondly, what about the shortages of beds and masks that was reported earlier? Has the demand been met by China?
Well, that's why they're sending more medical workers to the epicenter of the coronavirus outbreak, and they're taking the advantage of military medical teams. So there are 2 advantages of military medical teams. First of all, they're well-disciplined. They take action quickly and professionally. And second one, they're very professional and experienced in during treating unknown viruses. So they have a comprehensive system to dealing with that. So the frontline medical workers will get more and more professionally trained. You also asked about the beds. So the local authorities are kind of renovating the exhibition centers and schools and hotels into kind of a makeshift hospitals. By that means that there are more and more beds available. Once they discover anyone who got fever, they will be transferred to those centers so that they can being taken care of in a professional way.
Meanwhile, the death toll in Hubei province has dramatically spiked over the last 2 days. Now, what's the reason behind that? And what's the new method of diagnosing that China has adopted, and the timing of this decision of the new method?
Exactly. So Chinese government has been always very transparent in terms of the infected cases and death toll of this coronavirus outbreak. You're talking about the death toll rise in Hubei province, but if you take a look at the whole country, the death toll the infected rate has dropped. So that means that the suspension of mass transport has taken into effect, and the epicenter, residents of the epicenter has made huge sacrifices to make the disease controlled. But over here, if you're given the larger pool of infection rate, people compare this with SARS, it still has a relatively lower death rate. So in terms of vaccine, the local government is still trying to figure out the possibility of different types of vaccine, and hopefully we can get to know more update on that information soon.
One more question to you. Now, the World Health Organization has said that the infection has slowed down in the past few days. Now, what's the update on that front? And you mentioned a vaccine. Are we closer to finding a cure yet?
Well, it's simply because as soon as there's a hypothesis of the vaccine, the market is definitely not ready. There's a huge consumption in that kind of medicine. So the local authorities are very cautious about releasing the details on the development of vaccine. But what we know so far that they have advanced their speed of testing or confirming the diagnosed cases. Previously, they have to send the samples to Beijing, but now they don't have to. They can only they can test the samples within the province. So we got a faster speed in terms of diagnose new patients, so that according to the different additions of treatment plans, the patients will be taken care of well.
Yunfei Zhao, thank you so much for joining us on WION Yunfei, getting us all the latest from Wuhan, that is the epicenter of the coronavirus outbreak. Let's move on and shift our